It has been stated that society in Africa will grow in safe hands due to the treatment of diabetes that develops in young children while being accompanied by intended health diet. Dr. Chizo Agu from Adeca has said this.
Hello, my name is Dr. Chizo Agu. I'm a consultant in pediatric diabetes and endocrinology, and I work in the United Kingdom. And I'm the course director for Adeca, which is Allied Healthcare Pediatric Diabetes Nurse Educator Program for Africa. So today we graduated the first 15 nurses from Tanzania, Nigeria, Cameroon, Malawi, Uganda, Ghana, and these are pioneers. They will be the first nurse educators that have been formally trained. They have been undergoing the course for 1 year, and this will help them look after children and young people with diabetes, working alongside the pediatric endocrinologists. The outcome currently of children and young people with diabetes in Africa is poor. Many of them die. Many of them develop complications, but with the knowledge the nurses have learned, they will be able to help to improve their outcome. And they will also be able to pass this knowledge on to other staff that work with them, train the doctors, train nurses, and train the parents of the children, so that we can start to change the narrative, so that these children can survive longer and lead a more healthy life.
On the other hand, Mr. Bakari Kanu is among of the graduates from Nigeria, has said.
Abubakar Ibrahim from Nigeria. I'm among the 15 nurses that were trained by this Adeca, Allied Healthcare Diabetes Educator course. I think the purpose of this training is to train nurses in the diabetes team management, because diabetes management is not meant for just one person. So doctors need nurses in their clinic so that the nurses will be offering the education part of diabetes management, and this will surely promote the well-being of children with diabetes, particularly type 1 diabetes. There has been increased mortality in patients with diabetes, and this is as a result of mostly misdiagnosis. When I say misdiagnosis, I mean some children will be having type 1 diabetes, and they will be diagnosed and they will be treated with something else. So nurses need to be trained in collaboration with other, so that they can work in collaboration with doctors, psychologists, nutritionists, so that the health of these children will be promoted. And this course started last year, and we were selected from across Africa. Like myself, we are 4 from Nigeria, 4 from Tanzania, 1 from Malawi, 1 from Uganda, and 1 other nurse from Ghana. And I've learned so much from this course. I've learned how to manage diabetes. So many aspects of management of diabetes were taught. Because prior to this course, I did not have knowledge. I did not have much knowledge regarding the management of diabetes. I've learned how to use patients to count their diet, their food, in order to give the accurate dose of insulin. And I've learned how to correct hypo. So when I say hypoglycemia is a condition where the blood glucose level is low, and there's a situation. So we will also be trained properly how to manage such cases, and even the hypers. When I say hypers, I mean when the blood glucose level is high, and we've also been trained how to give psychotherapy, how to give counseling. We've also been trained how to manage sick days. Meaning, when I say sick days, I mean those days that children with diabetes are unwell, they are feeling sick. So we've been taught so many aspects of diabetes, and we are willing to And we are so grateful to our facilitators, our lecturers, for this great opportunity. We've really done a great job, and we promise to impact this knowledge to our patients so that they can be living healthily, and this will promote their health. Thank you.
Reporting from Mosh Kilimanjaro region, Roman Vanziacharo, Mzava TV.